Actually, I was in clinic, and the phone rings about 12:30 in the middle of a clinic day, and I answer it, and they said, "Is this Lieutenant Commander Kazee?" So I knew right there it probably was going to be the news, because we'd been warned of it, that this was probably upcoming in our reserve centers. So I was like, "Yes, sir?" And he goes, "No, I'm not a sir, I'm a chief." But so I said, "Yes, chief." And he said, "Can you be ready to mobilize and report to New York City by this Thursday?" So it's one of those, I can't really say no. So of course I said, "Yes, chief." And in that moment I had 36 hours to pack up, get on a plane, and get to Fort Dix. Initially being here in this wonderful community of Goldendale, I'm one of those that just believed it was, it's not really bad. It's sort of just a bad flu bug going around. But that changed when I got to New York City and actually saw how serious COVID is. So we overnight flew the red eye from Portland into Pennsylvania, got bused to Fort Dix. From there we checked in, got all the fitted for gear, and then they bused us to New York City. Once arriving in New York City, I was in the second wave of medical team responders. Ended up being 7 waves completely. But in the second wave, they assigned us to a hospital or to the Comfort, which is the Navy ship that was stationed there in dock. I got assigned in a hospital team that was supporting North Central Bronx Hospital. We totaled out at 7 different medical teams that were with the critical care providers, trauma providers, CNRAs, so you had your anesthesiologists, your nurses, the entire team, and we reported to hospitals. North Central Bronx was in a severely affected area, and we went in there just to help out wherever we could. It's worse than a war zone. Just massive amount of casualties, and you don't know who to help first. Everyone needs your help. Supplies were a little delayed coming in, but they were there. I was never at risk for my own personal safety. They had the N95s, they had the gowns and gloves. But just the emotional shock of it all, because a lot of times you don't even know at first if you're doing any good. So it was definitely eye-opening. I had no idea that it could hit that bad and that quickly. We got there and walked in, and the first thing the doctor saw us is, "We are so glad you're here. Where were you 10 days ago?" And that was their outlook on it, that they were left there struggling alone. They said after the Twin Towers collapsed on 9/11, there were people there the next day trying to help. With this pandemic, hundreds of people presenting to the ER every day, just at that one hospital even. 30% of their staff left, either because of the overwork, the stress of the pandemic, or they were feeling symptoms themselves. So they were trying to do the most they could with very few people on board. The biggest thing that I know the news has hit on, and they really had no choice, is you have 100 people coming into the emergency room. Your hospital's filling up, so if you have cough, fever, diarrhea, symptoms like that, but you were stable, they have no choice but to discharge you or release you from the emergency room to save the space for those that needed oxygen, that weren't doing well, could barely, walk up a flight of steps, they were so weak. So here, New York was hit for that, or the mayor was hit for that, for sending infected people back to their homes or the nursing home. But where else would they put them? The hospitals had no room. It was that bad. And there was really no treatment. They'd come in through the ER, we'd get them the hydroxychloroquine, we'd start them on a Z-Pak or azithromycin for possible pneumonia. Other than that, the only ones that got admitted were the oxygen. They had to have oxygen because saturations were low. They couldn't get a deep breath, they couldn't talk. So we'd admit them for oxygen, tried to keep them off the vent as long as possible. But this virus is just so virulent. It just lives on surfaces so long. and there's really nothing you can do but help the body fight it off. There's no magic treatment out there for it except for the body catching up with an immune system. The bad thing is some of the people would come in, probably the majority of them, that needed oxygen and had to go on a vent. They call it the cytokine storm. It was classic. Day 10, they'd be fine, giving you the thumbs up on their nasal cannula and their non-rebreather oxygen on their face, having problems talking a little bit and needing help to get out of the bathroom, up to the bathroom, but overall doing a little bit better when they first admitted. And then within a couple hours, they would just crash. I mean, saturations would drop, they couldn't move any air at all, and our only choice was to put a breathing tube or intubate and try to expand their lungs just till the body could heal. When we first got there the first week, the hardest thing about it, because we're stepping in, because you want to help. You want to get there in the bedside. You want to do something to help these people. One, they're separated from family. They're dying, very, very sick. And the hardest thing is even with everything going on and all we could do to help the massive amount of people infected, we lost just at that hospital during the first week to 10 days that the Navy was there, 18 to 20 patients a day. And that's just this one hospital. So the countless hospitals through New York, probably 30, 35, you figure 18 to 20 patients a day. And it was an eye-opener. I mean, you didn't realize that something could hit that bad that quickly. The Navy team, our Navy team, we came prepared to open our own unit, so like an additional overflow COVID unit. The hospital at North Central Bronx, the OBGYN clinic, the psych unit, the PACU, the ER, the ICU, the medical surgical floors were all COVID. There was no non-COVID patients in that hospital except for mother-baby. And even there, moms that came in to deliver were swabbed for COVID. And if they were positive, their infants were separated from them for 14 days. It was that serious. So the Navy, instead of opening a new unit because they didn't have the space at the time to open yet another unit because they were full, we stepped in, started working 12-hour shifts to support the medical staff already there. So critical care nurses tried to go up to the vented patients, providers of different levels. You have like an OB doc running a critical care unit. You have a podiatrist working in med-surg. It's all COVID. So anyone with a license and with the capabilities was just sent in to help in any way we could. So I was initially assigned to help with incoming physicals because I'm a mid-level provider as a nurse practitioner. Then they realized with me being a pediatric nurse practitioner that it was sort of over my license ability and my comfort level. So I was assigned to the palliative care team to help families and their patients connect. Very rewarding, but there were days I'd leave the hospital in tears because there wasn't a whole lot you could do for some. It's definitely how they call it, the novel coronavirus 2019. It's definitely novel. It's nothing that we could have even prepared for if we knew it was coming. I don't think anybody realized that there's nothing you can do but help support the body. So it's all just oxygen and ventilators. I think it's spread through New York City. It's just guessing. The subways and the crowds. New York City is people on top of people. And then, of course, people were popping positive. There's nothing you can do. They're having symptoms. They're going back out in the community, and there it just spreads more. I think, yeah, we've never seen anything like this before just because it lives on surfaces so long. And it's so virulent. It just doesn't hit the lungs. Day 10, kidneys shut down. Your body throws multiple clots. You start swelling, bleeding. You have to go on hemodialysis. You're just playing catch up the entire time, trying to keep them alive to where the body can eventually kick in and start helping. Definitely because you want to help. You're doing all you can, but there's part of you that just feels so helpless. And I think the hardest part as a provider is with cancer, with other illnesses, even traumas. The family can be there. with this, the patients are so isolated. The only time family is even allowed at bedside is during their last hours to say goodbye, and even that sometimes isn't possible. So I think that's the hardest part of it, is not having anyone around you as you're fading. So as providers, not only are we helping to take care, but we're also doing that personal aspect too, where, hey, there's somebody with you, we'll be here with you. Even if they're not comprehending what's going on because they're sedated and they're on a breathing tube, you still know there's a part of them there that feels so isolated. I did pretty well with it. I found that when I would get on the bus, I would, because we got bused to the hospital and bused back to the hotel. And of course the hotel, everything in town is shut down. So there's no food, there's no environmental services. You put your sheets outside the door once a week. They give you new sheets and you make up your bed. But it was a place to stay nice, but of course all the amenities, there isn't any. You check in, check out every day with the mustering petty officer, and you find things to keep yourself busy. My way of coping is I put in music and I go for a walk. So I'm in an abandoned city. Of course there's homeless and stuff and a few cars still on the road. I would just put on my music and walk. So sometimes I would walk 12 miles a day, just listening to music and trying to step away. You just try to leave the hospital at the hospital and come back and try to get some kind of normalcy in your life, knowing that the next day you go back again. Because we were doing 12-hour shifts when we first got there. It was 6 days a week. We'd have one day off. And when you get back on the bus, you're so exhausted that you talk a little bit to your coworkers. But other than that, you sort of go in your own world and try to unwind the best you can. As far as the illness there, you realize you're pretty much, it just gives you a good outlook on your life, where you want to go in and help. I mean, as medical staff, nurses, things like that, we always want to help someone else, help them feel better, do better. I felt like I made a difference. It definitely was a rewarding experience, although heartbreaking. But on a good note, with New York City, for example, as fast as the viral load hit and hospitalized everyone is as fast as it dropped off. The first 3 to 4 weeks, we were 6 days a week, 12-hour shifts, not getting a break. After that, it quickly dwindled down to they started giving us just 4 or 5 shifts a week, to where we backed off, where the hospital started opening up other units, transferring other COVID patients in from other hospitals. So as quickly and how virulent that virus was, it also dropped off really quickly. So there's hope there. Other than that, it's hard to explain. So every morning we show up, stand 6 feet apart, we're wearing our masks. The clothes we wear into the hospital, we take off and then we don up. They gave us scrubs and N95 masks, so we'd have to go through a donning and undonning drill. So a couple of the things we noticed as the Navy getting in there, because they had set up these units so fast to save people's lives and to get them on vents, that there was one unit that had, it was very closed in, not very good circulation. Of course, they have 20 beds and stretchers where there's typically just 4 or 5, but they're just packed. So the staff had fans blowing on each, in the room to move air. So of course the Navy comes in and says, no, that's gotta go. I said, you're basically circulating this. So fans were done. We set up donning and undonning stations where you don up from just scrubs to leg protectors, a cover gown. You have a N95 mask on that you keep on all day long. You just don't take it off. And then over that you put a simple face mask, because that comes off when you come out of the hot zone, we call it, so that you're not messing with your N95, and you don't touch your N95 until you wash your hands. There were 3 pair of gloves, and so there was a method for getting dressed to go into the hot zone, and then taking off all the precautions when you come out of the hot zone. So with all this going on, and there's not unlimited supply of these PPEs or protective gowns and masks with the amount of people coming in and out. So you basically put the gown on and you stay in that stuff and that N95 the entire 12-hour shift. Yes. So the sores that you see where they interview people, they got a bloody sore right here from the mask fitting. Very true. You were in this stuff, you lived in it. And then you'd have a separate pair of nursing Crocs or shoes that you have to wear in the hot zones. Those came off and we basically had to throw those away. We couldn't even bring them home with us at the end of our tour of duty. With me, I just sort of tried to sleep well as best I could, vitamin D and zinc. I wasn't as nervous as a lot of the other staff, but it was pretty scary when 4 of the nurses, the critical care nurses that were up in bedside, came down with positive symptoms. They got a fever, cough, chest tightness, dizziness. So of course they were quarantined to their room. They had to get swabbed. They came back positive. So with 4 in one unit out of a team of 48, all 44 of the rest of us had to garb up in full uniform, march through downtown Manhattan, 7 blocks, to line up 6 feet apart, wearing our masks at 0700 in the morning to get the swab done. Fortunately, no one else that got swabbed was positive. But yeah, it gets very scary there because you realize that those nurses you've sat on the bus with. On the bus, we didn't have N95s, we just have simple face masks because you don't have to have the N95 if you're not around the aerosol vents and suctioning. But I don't think there wasn't one of us that didn't think, did I talk with one of them? Was I up close within that 6-foot rule? Because if they were symptomatic, they had a pretty good viral load. Did they touch the bus seat? And then I touched it and touched my nose. So yeah, after that, for a good 14 days with that going on, you're thinking, oh, I have a headache. Is it COVID? Oh, I'm having a cough. Is that COVID? So you can't help but always have it in the back of your mind of you have to put your safety first, even though you're taking care of very critical patients. I have a good friend of mine, in fact, that says, it's just a bad flu, and a lot of it's just political media up doing it. Should they have closed down the country across? Probably not, but when a town gets hit, it's hit. There's no halfway. The freezer trucks behind the hospital, true. The morgues couldn't keep up with the amount of bodies, the people that were passing away every day. It's unlike anything I've seen with 28 years in the military. I've seen, previous severe flu, RSV, working with pediatrics. There'd be times in Tennessee where you'd have 28, 30 kids in there all coughing and needing oxygen, but they would survive. This, overall, no matter what anybody says, once you were hospitalized and put on a ventilator, maybe 35-40% made it off the vent, and a lot of them made it off the vent with trachs. It's a nasty virus. I haven't seen anything like it before. So every time we extubated, where somebody was successfully taken off the vent, they would play a song. I wish I could think of the name of it, or I'll have to look it up. And then every time somebody got discharged, they would play New York, what a wonderful town, I want to see New York. And it was just like an episode of it. And throughout the entire hospital, whenever they would play the song that you were extubated, everyone would stop what they were doing and just do a big hoo-yah. We'd all clap and woo-woo through the entire hospital. So it basically lifted your day that there were some people coming off the vent for as many people that were going on it. So it was uplifting. At first, It wasn't playing that often. And then the longer we were there, more songs of successfully coming off the vent, and then a lot more of being discharged. So it gave you hope. The eerie thing is in between that, every once in a while you'd hear the song for a baby being born. And it was almost kind of sad. I mean, typically it's a happy song, but you're thinking, here's the child in the nursery, surrounded by COVID, maybe separated from its mom. So it's almost kind of a melancholy tune compared to the hoorahs for coming off the vent, because everything in that hospital was COVID. It was all wrapped around COVID. There was a good news though. One lady came in, COVID symptoms, cough, fever, shortness of breath, but severe abdominal pain. So they admitted her. People did not want to get anywhere near the hospital because they thought they could catch COVID just coming to the hospital. And we're probably the safest place because of all the cleaning and gowning. But she came in, tested positive for COVID, but they did a ultrasound for her abdominal pain. She had a rectal mass, or a mass in her intestines. So if she wouldn't have been coming in for COVID symptoms, probably never would have been caught, because she wouldn't have come in to the hospital because it was a scary place at the time. So that was a good thing that I actually met with this patient, that if it wasn't for COVID, we never would have caught the mass. So you have to look for those little pearls, because your day was so mentally exhausting that was one thing that always got passed on the bus. Oh, guess what I found? So it was positive. The scare was that even though things had settled down, are they ready to let the military go in case there's a resurgence? So how they did it is, of course, multiple meetings with the Chiefs of Naval Operation and FEMA. They decided the first thing that could go would be the Comfort, which is the Navy ship. The Navy ship was the first one on the scene because it's mobile, ready to go, no setup required. And they got there planning to take non-COVID patients, traumas, car accidents, appendicitis, anything non-COVID could come on the ship. It's got 18 ORs, full recovery rooms, general medical wards. The things about the Navy ship, though, is most of the hospital beds fold into the wall and then pop down. So if you have a 62-year-old that's weak and coughing or short of breath and needs ventilator support, it's a little difficult. There's so many ventilator beds, and then the rest are just trauma beds or post-OR. So perfect for traumas, car accidents, any other medical condition that doesn't require a lot of intubation. So that quickly changed when the hospitals were so filled up. Then the Navy ship was changed to COVID also. So they, at one point for over 8 or 9 days, were completely full. So they would send their overflow out to the Javits Convention Center because the hospitals were full. So they opened up an entire convention center on the river, directly down from the Comfort, and between the Comfort and the Javits Center, which was run by the Army. They would flip-flop patients back and forth depending on how ill they were. So ambulances, instead of reporting to the hospitals that were full, would report right to the Javits Center. Javits Center would triage, admit to the Comfort, the Navy ship, or keep on hand there. Those were the first ones that got to be closed down as the cases started dwindling and hospitals started clearing out a little bit. The hospital I was at was one of, there were 4 hospitals that were COVID receivers. So as the other hospitals started to open up for OR, mother-baby, psych units, things like that, they would take their COVID patients that couldn't get weaned off the vents and send them or transport them to the hospital I was assigned to or 2 other hospitals. So Comfort got to leave, sail out first. Beautiful farewell. The whole New York City Police Department came out. They played taps. They did just all sorts of music and stood at attention as the Comfort sailed out. The Javits Center was the next thing to close down, which, because it's a big convention center, just filled. The hospitals then started closing down one by one. So the medical teams were shipped out 2 hospitals at a time. It felt like I was gone longer than just 2.5 to 3 months. I felt like I'd been gone from Goldendale for over 6 months or more. Look on back, it's almost surreal. The nurses and the providers got together and we did different shots and we put it in a little photo book, which is beautiful. I actually every once in a while open it up when I have time and just look through it, and it just seems so distant now from here. I hope it never comes here and hits. There's no way that anyone could be ready. You can set things up and have a plan in place, but it's just bad. The good things though about it is I do remember a scene that really brought tears to all of us. A lot of these hospitals we worked in did not have pastoral services. The Navy has rabbis and priests and chaplains, Jehovah's Witness, everything available. So one of the patients wasn't doing very good, and the family, who was in a different state, couldn't get to bedside because he deteriorated so quickly. But they said he's got to have last rites. He was Catholic. So one of the Navy priests actually 2 o'clock in the morning dropped everything, got there to bedside, gowned up and everything, and performed the patient's last rites before he took his last breath. And so they got a picture of him at the bedside performing the last rites with the nurse and the doctor. And it's one of those scenes that just, you feel like you made a difference. And that's one thing I bring back from it, that even though it was just hard, those little memories and those moments like that say, I was there, we helped, the Navy stepped in, and we made a difference. That's what gets you through it, is that you made a difference and helped some people. Or always when you join the Navy, you're thinking, okay, you support local hospitals, or you're there, working on military. And if you get called for something like this, it's overseas. This is the first time the military's ever been used, or the medical, to help something here stateside besides hurricanes and, just cleanup, and that's more like National Guard. But for a medical provider, typically when we're needed, it's in Afghanistan or working out of fleet hospitals, not in the States, in existing hospitals, taking care of our own people. So coming out of New York, and then especially into Portsmouth, Virginia, and about that time too, the protests were starting, and the riots and the lockdowns, and just you get scared for your life for even another reason completely. To land in Portland here and make the drive along the Columbia River Gorge and come up over the hill and see the beautiful Mount Adams, it was just such a big relief. Yes, in the first week I was here, literally every night I would just go out and mess with my horse and clean manure piles. It was just so amazing to be back connected. I don't know if I could ever go back to New York City again after this experience, and I'm sure other cities are getting hit by the same thing. Like I said, it's unspeakable. You really, like I said, I went out there thinking it was just a bad flu, and it's not. It was eye-opening. I'm just glad to be home in Goldendale.